Like to be timely, but waiting on a few members to have a quorum. But we're going to go ahead and start off with a prayer. Our newest member, Senator Bearden, if you would oblige us in a prayer to get us rolling here today. What number are you on there?
Bow your heads. Lord, we just ask that you allow us to do the right things for this state and take every bill that's in front of us and state it the proper way, and as I said, do what's best for the citizens of this state moving forward. In your name we pray, amen. So that was really quick. So
Yeah, I thought you were going to buy me some time there.
you want me to go with a full one, I can.
No, just we got word. We got a few more members coming, so here in just a couple of minutes we'll get rolling. But the first bill we're going to hear, HB 874. Representative Hawkins, if you want to get on deck and.
Mr. Chairman, 874 is addressing something that's already in code in the education code. For high schools, we have in code right now, AEDs will be in our high schools. This bill addresses K through grammar school, and it also puts into code what the high schools are primarily doing now, which they have teams of teachers or counselors that are their response teams. They are CPR certified and AED certified also. Well, you get AED training with the CPR. This bill calls for a second AED. It could be done as a bench during that year. You know, whenever something happens, especially with a little child or for us old folks, people start to panic. And if they do not have imprinted in them what they're going to do to save this person's life, then sometimes that precious time goes by and things go sour. That's the reason that is physicians and dentists and nurses, we still do CPR every 2 years. We have to do that to keep our license. So this bill does put it K through grammar school, so it will extend it now to K through 12. It is in the appropriations. It's in the education appropriations on the House side, 24.11.12. You'll see $362,000. Actually, we've been advised that there's only 75 schools in the state of Georgia that do not have an AED. So at $1,500, that comes out to $112,000. So we've got more than enough money in appropriations to cover this. That's the bill. If there are any questions, I'll stand for questions. If not, I do have someone here that I would like, Mr. Chairman, with your agreement to have speak. Dr. Jeff Marshall, a cardiologist, well-known cardiologist in the United States and actually outside the United States. He lectures all over. He was at Gainesville in North Georgia Medical Center. Now he's at Northside, but I've known him for a long time. He and a number of his cardiologist colleagues through the Georgia chapter of the American Cardiology College, came to me summertime, I guess, with this proposal, and I've worked with him, and I'd like for him to say a few words if that's possible.
Absolutely. First, any questions from the committee? No question. Yeah, we'd love to hear from him. Thank you.
Thank you, Chairman Dixon and member of the committee. My name is Jeff Marshall. I'm an interventional cardiologist, and I'll be brief. I work at Northside Hospital and am the immediate past president of the Georgia chapter of the American College of Cardiology and on the Georgia Composite Medical Board. But this is not something just from us. The whole house of cardiology and medicine is behind this, the AHA, CHOA, the Georgia Nursing Association, everybody's behind this. For your edification, sudden cardiac arrest like Damar Hamlin had or Bronny James is the third leading cause of death in the United States of America. And that probably shocks most of y'all. Unfortunately, 70% of those events occur outside the home. So for children, that often means it's school. And the sad thing is that the chance of surviving that and being what we might call a walkie-talkie or neurologically intact is less than 10% unless you get immediate medical care. That means CPR and a defibrillator. But when these things happen, as Chairman Hawkins says, it can sometimes be a Chinese fire drill. So this bill establishes an emergency action plan, much like a pit crew at NASCAR. I'm not a NASCAR fan. My daughter does some work for them. But when that car stops, everybody knows their job. Everybody knows what they're meant to do. This emergency action plan teaches our teachers and our school nurses exactly what they're meant to do when that happens. So this is profoundly important. I can't think of anything more important for our children than to have AEDs in schools and an emergency action plan to save children, teachers, visitors, even opposing team members and parents, right? If something tragic like this were to happen. So please support this bill. Thank you.
Thank you. Absolutely.
Before you leave, you named 2 prominent athletes that brought a lot of attention to this. Are we seeing an increase in youth on these type of events in schools, or is it just something now, social media and 24-hour news that we're seeing, hearing more about it?
I'm not a pediatric cardiologist, but I don't think that the incidence is increasing. The good thing that is increasing is survival from sudden cardiac arrest is increasing. And y'all have already put AEDs in most of our schools, and y'all have already created an emergency cardiac care plan for our state. So the chance of surviving in Georgia is actually better than the national average.
Thank you.
Anything else?
Any further questions from the committee? Senator Halpern?
This is less so a question probably than a comment, but I wanted to say to the author, thank you for this bill. I had a similar one that we also heard in this committee, and I think that we're onto the right thing when moments matter, and we can have the tools at our disposal to take care of it and make sure that our children can at least get the best care that they need in case of a cardiac event, both whether it's on the athletic field or whether it's inside of an academic classroom or the four walls of the school, that we should do all that we can to be able to know how to react systematically. I maybe do have one question, and that would be line 66, where as part of that designated internal response team, you've got it delineated that at least 5 school staff members must be part of that team. And so I want to just ask you how it is that you came up with that particular number, or would that, if we stress tested that in certain schools, would that be hard for them to actually manage?
I can maybe help with part of that. So one person would be designated to go get the AED. If this happens on a field and there's not one on the field, somebody's got to go do that. One person would go to the front of the school to direct an ambulance, the paramedics or the fire department, to where the problem is. And then the other 3 would tend to the child or adult that has actually had sudden cardiac arrest. So it takes a team like the pit crew. Everybody's got to know what they're doing, because fortunately, thank God, this is a rare event. But when it happens, everybody has to know their job.
Fantastic.
Thank you. Any further questions from the committee? We've got two folks that have signed up to speak. Richard Lumpkin.
Thank you, Mr. Chairman and committee members. My name is Richard Lamphere, and I'm with the Georgia Nurses Association. I'm also a member of the Project Adam National Advisory Council. Project Adam is a national organization in 42 children's hospitals in 32 states, one of which is here in Georgia. I was that program manager for 10 years, and as the chairman and the doctor mentioned, you know, this is so important. I've been able to go throughout schools throughout the state of Georgia and make sure they're prepared on a voluntary basis. And I know what happens when somebody isn't prepared injured and they don't know what to do. They haven't had that designated team member to respond in an appropriate reaction. And then part of this bill also includes a practice drill. We think that's the most important part of this, is to practice what you're teaching. I'd just like to give one example of a practice drill. The assistant vice principal said that, okay, the entire team will meet in the lobby, then we'll go to the victim. Now, as the program manager, I didn't think that was a good practice drill, but it was their drill, let them practice it, and as two people ran past the victim to meet the assistant principal in the lobby, and then they all came back to the victim. And one of the first things the vice principal said in debriefing said, that doesn't sound like a lot of sense. But they learned that in a practice drill. They didn't learn it the day of an event. So I'd just like to ask for your support of this bill. It's going to save a lot of lives in Georgia. Thank you very much.
Thank you. Then our last speaker, we've got Laura Brackey.
Good afternoon, Chairman, members of the committee. I'm Laura Bracey with the American Heart Association, and I'm here just to urge for your support for this bill. You've heard some really great points, and I won't go into a lot, but I did want to share two different stories with you of Georgia students. And the first, these are real, true stories. So the first, let me tell you a little bit about Audrey, who in 2021, during a field day, suffered a sudden cardiac arrest at her middle school. The school nurse jumped into action. She knew what to do. There was an AED at the field, and because of the CPR and the AED, Audrey's life was saved. Now I want to tell you a little bit about a boy named Monty. Monty had a cardiac arrest during his basketball game last November. And even though there was an AED there and in place, no one knew to get it. CPR was not started. And sadly, Monty lost his life in December. Monty's mom, Stephanie, wanted me to share these words with you since she couldn't be here, but I know she's watching. Monty was caring, fun-loving, kind-hearted, and responsible. He loved video games and sports just like most boys his age. He loved his sisters and was in the process of teaching his 6-year-old sister how to ride her bicycle without training wheels. My heart, including his grandparents, dad, sisters, is broken in so many pieces. We think about him every day. Having trained coaches and AEDs available at the right place at the right time could have potentially saved his life. No parent should ever have to experience this. So on behalf of Stephanie and the American Heart Association, I urge for you to support House Bill 874. Thank you.
Thank you. Chairman Hawkins, do you have any closing remarks?
I think you've heard it all.
Thank you. Thank you for bringing this bill forward.
Thank you.
Thanks. Any discussion from the committee? Seeing none, Chair would entertain a motion.
Second.
We got a motion do pass and a second. All in favor, raise your hand. Motion passes unanimously. Thank you.
Senate sponsor.
Oh, do you have a Senate sponsor?
Oh, Ben Watson.
Ben Watson. All right, thank you. The next bill we've got up is HB 1183.
Thank you. Thank you, Mr. Chairman and members of the committee. This, similar to the school measure we just heard, is another opportunity for early intervention and education, I believe. So HB 1183 is to increase the awareness of type 1 and type 2 diabetes. Many in our legislative body may not know that there are now simple blood screening tests family members and relatives of someone with type 1 diabetes can take to determine their risk of developing the disease during their life. By raising parental awareness of type 1 diabetes, we can help mitigate risks of dangerous complications often present at the time of diagnosis, like diabetic ketoacidosis, or DKA. Should this legislation help prevent or delay one case of DKA in a child, which is sometimes fatal but always costly and life-altering complication, often present at diagnosis, we should view our work as successful. Type 2 diabetes is also a consequential change for families and our healthcare system that is presenting today at younger and younger ages, often rooted in family history. There are ways, though, to prevent diabetes with diet and exercise modifications. Detecting type 2 diabetes with a simple blood test consistent with medical evidence is something for families and their children at high risk for the disease to consider in close consultation with their own physician. Getting a handle on type 2 diabetes will help us tackle and prevent long-term health care costs and consequences of the disease, like heart attacks, stroke, kidney failure, and even blindness. This legislation simply amends current 6 through 12 education code, adding educational information to parents or guardians on type 1 and type 2 diabetes. The materials are available, are non-copyrighted, and available to download free of charge. And this will only be if a local board decides that they do provide education on immunizations, infectious diseases, medications, or other school health issues to parents or guardians of students, then this would also be included. And that is the simple nature of the bill. If you have any questions, I'll be glad to try to answer.
Thank you. Yes, you got a question, Senator Steele?
Hey, thank you for presenting. Just a question in line 28, the DOE in cooperation with DPH shall develop and make available. It says they shall develop. Is there not any education on this currently, and do we have any guidelines on what they're going to be creating with that?
It is not there, but the guidelines are actually available from the CDC. That is the downloadable information. It's quite straightforward, just information to give you the signs. If you look on line 16 through, I believe, 27, it gives you quite straightforward information that needs to be included in that. A description of both types of diabetes, the risk factors and warning signs, a recommendation of the parent or guardian of the signs that are associated with it, a description of the screening process for both type 1 and type 2, and a recommendation that the guardian or parent would consult with their own physician.
Got it. Thank you.
Mm-hmm.
Any further comments or questions from the committee?
I think this is a very, very light touch. You're not demanding very much of them. Is there anything like this that's put in statute right now that says you shall provide this information, or would this be the first thing we're doing?
I believe there are others. There are others about flu.
Yeah.
And some other measures.
So there's already a list. We're just adding.
There
to the
are,
list,
and schools send out certain information. So that is, if they do it, if that system does it, this is one more thing that can help change and save a life.
Any other comments or questions?
Motion, Mr. Chairman.
Who's your Senate sponsor?
I knew you were going to ask me that, and I'm sorry I can't, but I will get back to you on that.
All right,
I
thank
will.
you.
We'll have one by the end of the day.
All right, good deal. Thank you very much.
Thank you.
Chair, entertain a motion.
Move to pass, Mr. Chairman.
We got a motion to pass and a second. All in favor, raise your hand. Motion passes unanimously.
Thank you for taking it up so quickly. I'll work on that sponsor.
Thank you, Representative.
Appreciate it.
Last but certainly not least, my good friend, Representative Hilton. We got HB 1122.
I'll switch it up. Yeah, I don't mind if I...
No, I'm easy going. Sit wherever you like.
You come on up, yeah. It's like Warren Daniels' playpen right here. All right. Thank you, Mr. Chairman, and thank you for taking up this bill so quickly. As Vice Chairman of the House Education Committee, I'm sure we would love to return the favor to you on your Senate bills. Also want to welcome your newest member to the committee. Congratulations, Senator Bearden. With that, I'm here to present House Bill 1120. I'm reading from LC 49189-0S. Hopefully that's what you all have. This bill accomplishes two distinct things. Under the first item, it accomplishes three in particular. The first, page 2 of the bill, definitions, and we're going to connect with Ledge Counsel in a second here, and I think he's got some wordsmithing to do on that section that we'll offer to the committee. If you then turn to page 4, this deals with our charter schools and the allocation in QB of superintendents and principals to our charter schools. We have some charter schools here in the state where you have superintendents and principals serving multiple grade bands, so up to thousands of students for one principal. So this allows for more of those like you would with a traditional school. So those bring them on parity. Part 2 of the bill, if you go to page 6, deals with really workforce at these schools. So what they're finding is we have part-time teachers whose children are unable to attend the school. So this resolves that conflict. So the teacher's on the way to school to teach, has to drop their kid off at a different school. One important note or amendment we made in committee in the House side, line 133, we didn't want folks working at the school for an hour and then being able to jump the line and have their child work there or have their child attend the school there. So we updated that to 20 hours per week, so right at part-time, a little over part-time. And then finally, part 3 resolves a conflict of interest on who may serve on a Board of Education. Right now, we exclude any employees of a local school system. We changed it to just executive level employees are not allowed to serve on boards. I will then transition into kind of the second part of the bill, and the first portion of the bill passed unanimously out of sub and full committee in the House Education side, and then passed on crossover almost unanimously. The second part of the bill is what was House Bill 1186 that we've added on to this. And this deals with the subject of transparency in education. We have what's called a CCRPI score that measures progress for students. We implemented that in 2012. The last measure of that was 2019. DOE has announced that they will go back to publishing those results now. They got a waiver to publish those metrics on all 5 at a time. What this bill calls for is producing a single score. We believe it's easier for parents to understand a single score. DOE has said they agree to that. There's nothing in this bill that would prohibit them from presenting the disaggregated information. We're just asking that they calculate a single score for parents. And then the very last page of the bill says that data then would be provided on the school websites, the system's websites, so that parents can easily find those. I think that ultimately the way we empower parents is by putting information at their fingertips, and especially in light of how much money we spend on education, we want to make sure we're getting our return on our investment, and making this data easy to understand and accessible is important. One thing the bill doesn't address is specifically the weights of how that aggregated score should be calculated. We're going to leave that to the grown-ups, but there was a healthy discussion in committee around how often and who ought to approve when that calculation changes. Because as you know, Mr. Chairman, if you change that calculation every year, you can then no longer compare year-over-year results. And so I'll leave it to this body if y'all want to address that subject. But my message to those calculating the score would be, hey, let's try to keep it at least consistent for a period of 5 years, if not more, so that we can compare and make sure we're making progress. And this is not so much to call out our bad actors so much as it is to reward and recognize those that are doing it right, and take lessons from them that we can implement in some of our other schools. So with that, I will pause for questions. I do have to my right here Bonnie Holliday, who is the Senior Vice President Strategic Development Strategic Officer for the State Charter School Association, and she can correct anything I got wrong.
Any comments or questions from the author? And I'll just make a statement. Thank you for bringing this entire bill forward, but that last piece dealing with the scoring, grateful for that. Hopefully, y'all can pass out Senate Bill 233 this year, and we can start moving towards school choice, and that will go a long ways in helping us score those bottom 25%. So thank you for bringing that forward.
Yes, sir. Thank
Yeah.
you. Senator
would-
Brass, to answer your question, is agreed to help us carry the bill on the
Senator
Senate
Brass.
side.
Okay.
Yes, sir.
Very good. And then I would be remiss, I waited till I had a friend, author here, but just wondering when y'all are going to get the budget over to us.
It
know-
was,
I know
it was,
you're not
it
on
was
the pro-
on our
but-
desks today, so I imagine we're going to have a vote very, very soon, if not by tomorrow, but
Yeah,
yeah.
because we're having very short session, floor session days until we get that
We
budget
noticed
across.
that.
so-
We noticed
but
that.
we're ready to get
Yeah.
moving, so.
We're ready to go,
I
yeah.
know you are.
I'm persuaded that Scott Hilton has that in his hands.
Yeah. Mr. Chairman, I appreciate your thoughts of me, but that may be slightly above my pay grade. I am going to defer to Legislative Council just on the tweaks we had on page 2 at the appropriate time for an amendment.
Yeah, absolutely.
I think you all need a motion.
We do need a motion. Any further comments or questions? Ten.
Thanks. Thank you so much. Okay, so first on, and good to see you, Bonnie. This, let's see, what page was I looking at? 88, starting at line 86. So a superintendent would be earned for each state charter school?
Right. State charter schools in current code are local education agencies, just like a school district. And what that means in practice is that they have all the same reporting and service requirements that a district has, but currently they do not earn superintendents to fulfill those obligations. That doesn't mean that they're not doing them. It's just they're funding someone out of pocket. They're not receiving any state funding for a position to cover that. Similarly, with the principals, 56% of state charter schools serve multiple grade bands in a single school, so like a K-8. But they don't, the way principal allocation is currently provided is by school code. So you could have a school on one side of the street, a charter school that serves K-8 and has 1,000 kids, and they pull one principal. And then you could have a elementary and a middle traditional school on the other side of the street collectively serving 300 kids, and they pull two principals because they've got two school codes. I don't think there was ever an intent to withhold principals from charter schools. I think that this charter schools were weren't even a glimmer in someone's eye when this allocation precedent was put into place years and years and years ago, and so this is just correcting that.
Okay, thank you for that. So the principal piece makes more sense to me than the superintendent piece.
It's
'Cause-
only for state charters, not locals, because only state charters are LEAs.
So each gets one? Like we have, how many state charters do we have right now?
48.
And so for like two of my systems, I have one smaller system, but we have one superintendent for, 95,000 children in DeKalb. And then, like one in APS, which has around 50,000. So I guess that's hard for me to wrap my head around.
It's
A superintendent for all 48? Like they each get one superintendent?
Right, just
We
like,
have-
it's analogous to, we have, DeKalb is, you're right, they get one superintendent, but then they get, based on QBE, a multitude of assistant superintendents as well.
There are regional superintendents. Yeah.
But then you've got, smaller districts like Sly County and some of those that have fewer students than some of our charter schools, and they pull a superintendent because it's not based on size, it's based on those reporting, because you have to fulfill all of your state and federal reporting requirements, and then all of the obligations to serve all your students in federal programs.
So in terms of our big systems, would this like match it up, or would it be that the 48 charters get more personnel than like my school system in DeKalb does?
No, it would bring more parity for state charters, because right now, like every school district LEA in the state gets a superintendent regardless of size. Charter schools do not. The state charter schools that are LEAs do not. And so this would bring them up to parity there. The bigger districts get additional funding for staffing for those assistant superintendent or those district office positions, and those would scale up based on the QBE of the district.
So you think it just makes it all equal?
Yes.
Okay, can I ask one question about the last section that got added on? So I know we have various rating things right now, and we've gone through different versions of that since I've been here, and frankly, I don't really recall where we are with everything. What, in terms of these rating systems, can you remind me what they're based on? You know, I think it's a concern that a lot of times scores track very closely with child poverty, and it really says a lot more, maybe not exclusively, but in some ways more about the kids that are at that school than it says about the quality of the teachers. How is that accounted for in this rating system?
Yeah, and if you don't mind, I'm going to share with you a one-pager here. This is the 5 categories that are, just pass this on. Sorry.
Thank you.
It includes content mastery, graduation rate, progress, and I believe those are some of the proposed weights that they're looking at to roll up into that single score.
So this, okay, I think I have looked at this. Is this the new, did they change this recently at DOE?
Yes.
Okay, and
This
so-
is new for the 2023-24 reporting.
Yeah, so so if there's a single score, how do they know how it breaks down across the 5 categories?
Yeah, again, so that's for DOE, GOSA to decide the weightings of each of those. I think you'll see some on there that they've proposed, and essentially they would just multiply, you know, whatever the number is by that percentage, add them all up. And the goal of the bill is so that parents aren't having to do this math themselves and change weightings and all that to make it simple and easy and transparent. Not unlike you go into a restaurant and you have a single health score.
Yeah, but a restaurant is real different than human children. It looks to me like 2 out of the 5 of these would account for some aspects of child poverty in the home that they come from, but the other 3 really don't. So I don't know that
And the bill is.
I feel like they're a little misleading and that they can do damage by misleading parents into saying, and it happens all the time. It's on Zillow, you know. I just don't know how.
Well, and that's the issue.
I think people buy into those things without realizing like how are children from backgrounds like yours doing at that school.
And that's why we wanted the bill, because in a vacuum of the state not producing that, you get these websites, niche.com and others that provide school rankings that are, who knows what they're based on, you know. And so when folks are Googling, where do I want to live, we want a single source of information as this is where I go to find out if schools are good or not. Factual, clear data to understand.
The whole issue is how can you even say they're good or not?
Well,
Right?
and
I mean,
that's a debate for another day and not something the bill tries to tackle. Yeah.
Thank you.
Thank you.
so much for answering the question.
Senator Seltzer,
Appreciate it.
Setzler, sorry.
Thank you, Mr. Chairman. To the author, appreciate that. I did want to address some things to, and I appreciate the Senator from the 41st questions.
42nd.
I'm still learning these, thank you, yep, yes. You know, the funding for the principal and the superintendent, I mean, you think about the functions. As I think about a function for a principal, you know, being a building leader, running the school, you know, the issue of K-5 and then 6-8 being distinct roles. You know, there are charter schools in my community that have 800 to 1,000 kids in them. I think if we go down to, I think the Quitman County superintendent told me he had 400 and something kids in their entire school district, you know? So I'd say all this, Mr. Chairman, I mean, what I'm hearing you say, I just wanted to confirm this is your thinking. So you've got a charter school of, say, 800 kids, many of whom, because there's not even the facility funding that our traditional schools have, certainly in the metro area that have SPLOST or bond referendums to fund the capital, they're taking operations dollars to fund, you know, the 20% of the overall operating cost, which is roughly facilities. They're pulling that out of operational funds just to fund the building and the facility. And then on top of that, you think about all that a principal does. They do their day job, and then as it stands now, I believe, that on top of that, the school district functions, which if you're a school district person, I'm sorry if I'm overlooking a bunch of things you do, but it's human resources, compliance, meaning state, federal compliance, financials, legal, finance, food service, all those functions that are district office functions are piled on top of the principal. So you're a charter school principal, you're not only being a principal, but you're doing it with 20% of your funding being diverted to facility, and then, oh, by the way, you're also doing the superintendent job as your sort of your night job. So this is just providing funding so that superintendent function can be done and funded so the principal can be an effective principal. Is that what this does?
And you think a principal, the needs of a child in lower school are much different than those of that in middle school. And one principal over both is taxing in a lot of different ways for a lot of the reasons you outlined.
Yes, sir.
Yeah.
Appreciate the bill.
Any further comments or questions for the author? Seeing none, Chair would entertain a motion. We got a motion to pass. Got a second? Yeah, and then we'll take up the amendment.
Thank you, Mr. Chairman. I would recommend on replacing actually lines 27 through 29 of the bill with the following. Line 27 would read local charter schools and system charter schools, comma, as such terms are defined in Code Section 20-2-2062, comma, or college and career academies that are charter schools, period. That language would replace the entirety of lines 27, 28, and 29. So it would read local charter schools and system charter schools as such terms are defined in Code Section 20-2-2062, or college and career academies that are charter schools.
And Bonnie can explain why we made that change, but it was sort of clarifying language as to what we mean in that section there.
Doesn't change anything about the bill in practice or the intent of the bill. It clarifies the difference between local charter schools, which are not LEAs, and state charter schools, which are LEAs. And I just want to give a shout out to Ledge Council, who has to deal in code with the terms LEAs, LUAs, school systems, and school districts, because that appears all over the code, and it's sometimes used interchangeably and sometimes used specifically for one and not all of them. So there may be a code cleanup need in the future, but that's what that amendment does. It's just a friendly amendment to clarify.
Any comments or questions on the amendment? Chairman would entertain a motion to move the amendment. Thank you. All in favor, raise your right hand. Sure. We got a second. Okay, thank you. All in favor, raise your hand. All opposed? Passes 6-1. Now we'll take up the bill. Got to entertain a motion on the bill? Yeah. Oh, we do. All in favor?
Yeah,
We already did that.
Yeah, we did, yeah.
Discussion.
Sure, go ahead.
Thanks. Just wanted to say I really appreciate the bill, and I'm definitely leaning towards supporting the charter schools piece after all that excellent, and I'm a big proponent, as Bonnie knows, of our state charter schools, and I appreciate Senator Setzler's comments, elaborating on the experiences you've had in your district. I do have a little heartburn with that last piece. Haven't really had a chance to think about it too much, have some information flying at me related to it, and worry a little bit that since it didn't get out of the House, that it could imperil the good work of the other piece. So I'm going to vote no for that reason, but just wanted to let you know where I stood.
Thank you.
Thank you.
Any other comments? All in favor, raise your hand. All opposed, same sign. Bill passes 4-3. Thank you.
Thank you, Mr. Chairman.
With that, we are adjourned. Thank you for everyone showing up today. Appreciate it.